Welcome to this online version of the free childbirth education classes we are proud to offer here at UNM Hospital. Thank you for choosing us to care for your family during this exciting and transformative time. This presentation will cover labor stages, coping with labor, pain management options here at UNM, and a brief description of induction of labor and cesarean section. We designed this to be either a reminder for those of you who were able to attend a live class or to stand alone as a brief introduction to the care we provide. Please feel free to write down any questions, hopes, or concerns that arise as you watch this presentation to share with your provider at your next visit. We'll begin with a brief discussion about the stages of labor. Labor progresses differently for every woman and in each pregnancy. However, even though each labor is unique, there are predictable stages of labor. They just unfold in an unpredictable way. This means that each stage will happen in every birth, but no one can know how long they will last or what they will feel like in your body. For every woman, the beginning of labor is called early labor. Contractions are typically irregular and may start and stop in this stage. During early labor, the cervix softens and thins out. It also begins to open or dilate. Eventually, labor becomes increasingly intense with sustained, strong, regular, and rhythmic contractions. This is called active labor and is the phase of labor when the cervix opens completely. When the cervix is completely open, it's time to start pushing. This is called the second stage of labor and lasts until your baby is born. Once your baby is born, there's still a little more work to do. The placenta is delivered in the third stage. Some women will tear during pushing, but not all tears will require a repair. The recovery period on labor and delivery lasts 1 to 2 hours for most women. Once you and your baby are stable, we take you to the mother-baby unit where you will rest and recover until your discharge home. We're going to spend some time talking about early labor because this is the part of labor that will happen at home. It can be a challenging phase of labor because it can start and stop. It can be long, even lasting days. And it is the time in labor when women and their support people are trying to figure out if they should go to the hospital. So, what is happening in your body during early labor? During early labor, the cervix is softening, thinning out, and beginning to open. Now, let's talk for a moment about what the cervix is, because it's going to be a word that you'll hear your provider and nurses say a lot. The cervix is the opening of your uterus. Most of the time, it is thick and strongly closed to protect your baby. During labor, it is the part of your body that softens, thins, and opens with contractions to allow your baby to be born. During early labor, it is common to have irregular, uncomfortable contractions. These contractions may feel like strong menstrual cramps, or back pain, or intense tightening of your belly. Most women can walk and talk through these contractions. They may start, get into a pattern, and then peter out. This can go on for hours or even days. Early labor lasts until your cervix is open to about 5 centimeters. It is a lot of work. And most women are not admitted to labor and delivery until the active phase of labor. So this is typically work you and your team will be doing at home. What's the best way to take care of yourself during early labor? Rest and relax. I really can't say that enough. The work of early labor is very real and it can be exhausting. It is incredibly important to rest and relax as much as possible because there is still hard work ahead. It is good to think about your strategy for coping with early labor at home before you're actually contracting. Ask yourself what will work for you and consider a plan with your partner or support team. How are you going to cope with labor before it's time to go in? How are you going to take care of each other? Here are some tips and tricks for surviving early labor. It's really important to eat frequent, small, protein-packed snacks. Sleep whenever you can. Even half an hour of sleep will serve you well later on in your labor. Drink water and plenty of it. There are breathing and relaxation techniques that can help during or between contractions. Massage, movement, distraction, support, and taking a warm bath can also help women rest, relax, and cope with the pain of early labor. It is important to practice these techniques before you actually need them. Once contractions have started, you will not have the focus or desire to try a new breathing exercise. Take time now to practice relaxation techniques and choose what might work for you. None of us know what will work in the moment, but it's great to have options. Let's take a moment to try a mindfulness breathing exercise that you may find helpful to relax between contractions. There is no right or wrong way to breathe in labor, but deep breathing with a relaxed face and jaw does promote relaxation. Relaxation is the goal. If this doesn't work for you, try any other deep breathing exercise that does appeal. Partners, you need to relax too. It can be stressful to watch someone you love experience pain, even if you know that the pain is normal and productive. Deep breathing can help you cope with contractions too. Sit comfortably. Place one hand on your heart and one on your belly. Take a breath and notice where your body moves. It's very likely that, like most of us, you felt your shoulders rise. Take another breath, but this time, try to move the hand that's on your belly. Notice if your jaw or eyebrows are tight and consciously relax them. Take another deep belly breath, trying to move your hand. If you notice tension in any part of your body, imagine your breath blowing that tension away as you exhale. Sometimes it's helpful to imagine your breath as a color. As you inhale deeply, see that color travel all the way down your throat, into your lungs, and then spread into your belly and back. As you exhale fully, see the color travel out of your body. Now, extend your non-dominant hand. With one of your other fingers, you are going to gently trace up from your wrist to the top of your thumb while you inhale with one of those deep belly breaths you just practiced. As you exhale fully, trace down your thumb. Inhale and trace up your index finger. Exhale and trace down your index finger. At your own pace, trace up as you inhale and down as you exhale until you've traced each one of your fingers. How do you feel now? Do you notice any change in your body? In your mind's eye, scan your body briefly. Do you notice tension lingering anywhere? Take one more breath and blow it all out. When you're ready, open your eyes. Another technique that may work for you is guided imagery. Partners, you can help with this, and it may work for you too. So let's give it a try. Close your eyes and take a cleansing breath. In your mind's eye, imagine a place where you feel entirely free, completely loved, and totally safe. This is different for everyone. It may be a beach or a mountain meadow. It could be a place that you visited often or only one that exists in your imagination. It could also be your grandmother's kitchen or jumping out of a plane into the open sky. Any place that feels right to you is the right place. Once you've chosen a place, take a breath and really step inside it. What is the first thing that you see? Is there a bright color? A vast expanse of sky? A wildflower? Is there a person in this place? What do you see here? Now bring your attention to something you can touch. Is there a texture beneath your fingers? Sand covering your feet? Do you feel breeze or a gentle rain? Is there sunlight touching your face? Do you hear anything in this place? Waves, wind, someone singing to you, What do you hear? Draw your attention now to something you can smell. Is there delicious food cooking on the stove? A loved one's perfume? Take a moment to inhale deeply and really smell the scent of this place. Is there a smell here that surprises you? How about a taste? Can you taste anything here? Are you sipping tea? Does the air carry the taste of salt? Scan this place again and notice one more detail. Take a moment to make that detail even more vibrant. This place is always accessible to you because it lives inside you. You can return here anytime you need to, for any reason. You are safe. You are free. You are deeply loved. Take one more deep breath and begin to release this place. Begin to return to the present moment by wiggling your fingers or your toes. And when you're ready, open your eyes. Take a moment to notice how you feel now. Are you more relaxed? Can you feel your breath come with more ease? Is your heartbeat slower? None of us know if this will work for you during a contraction, but it might. It can certainly help you rest and relax between contractions, and any amount of rest will serve you well. Massage is another helpful way to relax during early labor and is a technique that should be practiced early and often. So partners, you're up. Your homework assignment is to give your pregnant person a generous massage anytime she wants one. You can massage her scalp, neck, shoulders, back, and feet to help her sleep or relax after a long day. A bath is another great way to rest and unwind. The water shouldn't be too hot, but warm enough to feel relaxed. Getting submerged in water is a great way to manage pain in early and active labor. So, remember this one. Before you do anything else, try taking a nap. Remember that any amount of rest will serve you well in the active part of your labor and while you're pushing. Give yourself the gift of sleep while you can. There is absolutely nothing more urgent than sleeping. When you can't sleep anymore, and if a bath isn't working for you, try walking, moving, dancing, and position changes. Positions like kneeling, a supported squat, or sitting on a birth ball can help with pain during contractions in early and active labor. Movement is incredibly important. Movement promotes your labor progress, gets your baby into a great position for birth, and can alleviate pain. Partners, you can help with this too, but remember, rest first for as long as you can, and then, as your labor gets more active, rest and relax between contractions. Distraction and affirmation are other techniques that may help. Distract yourself by listening to music or watching a movie, take a walk or bake a birthday cake. This may be an opportunity to involve your older children in an art project like a welcome banner or a birthday card. Affirmation is a useful technique for all people, partners included. You might try making birth affirmation cards. Write something kind to yourself, your baby, or your partner on an index card. I am strong enough. We can do this together. We can handle whatever comes our way. I am powerful. There are many examples available on the internet. You will know what feels right to you. Affirmations can feel awkward at first, but they are incredibly helpful. They are also a really nice way to communicate with your partner about what words may help you during contractions. At some point, you will feel a noticeable increase in the intensity of your contractions. They will become more regular and will organize into a sustained pattern or rhythm. For example, you may notice that in early labor, contractions come every 5 to 8 minutes, but get closer until they come every 2 to 4 minutes. Regular, strong, rhythmic contractions are a sign of active labor. Most women can't talk during these contractions because they require your entire focus and energy to breathe through them. Active labor begins around 5 centimeters. In this stage of labor, your cervix thins and opens more rapidly than in early labor. This is the stage of labor when most women will be admitted to labor and delivery. There are some women who will be admitted in early labor, but that is less typical. This is the stage of labor when most women will also need support coping with contractions. That can mean many different things. We'll talk about options for pain management on labor and delivery a little later in the presentation. Active labor is typically faster than early labor, but it is still unpredictable and unique for every woman and in every labor, even for women who have had babies before. Active labor lasts until your cervix is completely open. You may hear your provider say you are dilated to 10 centimeters or that you are complete. These are ways of saying that the only thing your provider feels when they check your cervix with their fingers is your baby's head. So, what should you be doing during active labor? Come on in to OB Triage. OB Triage is open 24 hours a day, 7 days a week. It is located on the 4th floor of the Barbara and Bill Richardson Pavilion, which is the newer part of the hospital. If you are ever unsure if you should be seen in OB Triage, please call the Nurse Advice Line at 877-925-6877. You can have 2 people with you in the triage room. Please remember that OB Triage is an emergency room for pregnant people. We will see the women who are sickest or in active labor first. We prioritize the most urgent cases regardless of who registered first. So there is sometimes a wait to be seen, but we are absolutely committed to getting you in as quickly as possible, no matter what brought you in. Please come into OB Triage when your contractions are regular and strong. If you think that your bag of water has opened, sometimes that is a gush, and sometimes it's just a small amount. One good way to tell if your bag of water broke is to put a pad in place. If you notice that you continue to leak fluid uncontrollably, even if it's not a super large amount, that might be your bag, and it's time to go get checked in OB Triage, even if you don't have strong contractions yet. Another important reason to come into OB Triage is if you're not feeling your baby move. After 28 weeks of pregnancy, we expect your baby to move at least 10 times in 2 hours. If you do a kick count and you don't feel 10 movements in 2 hours, come into OB Triage and we'll check on your baby's well-being with monitoring. It is also important to come in for an evaluation if you have vaginal bleeding that is heavier than light spotting. So, if you're bleeding like a period, it is time to come in for an evaluation. If you are ever unsure, call the Nurse Advice Line at 877-925-6877. You are the expert on your baby and your body. If you feel like something is wrong, you can always come in. We are very happy to take care of you anytime. When you come into OB Triage in labor, the secretary will sign you in. We will check your weight, heart rate, and blood pressure, and have you change into a gown. You don't have to wear one of our gowns. You can wear anything that feels comfortable to you. But our goal is to be able to put your baby on your bare skin right at the moment when he or she is born. So whatever you wear, it's good for it to be loose and light. The nurse will put monitors on your belly to listen to your baby's heart rate. A provider will check your cervix with their fingers to see how dilated you are. If you are 5 centimeters dilated or your bag of water is open, you will be admitted for labor, and the nurse will start an IV and draw routine lab work. Having an IV in place is our standard of care. However, every intervention is a choice. You are free to decline an IV. We use it to give you fluid and medicine. If you want an epidural or pain medicine, you will need to have an IV in place. We also use it to give medicine after your baby is born to stop you from bleeding too much. Some women can safely have an IV in place without hooking it up to IV fluids. Let us know what your preference is, and we can discuss all the options with you. Fetal monitoring is the way that we listen and see your baby's heart rate to determine how your baby is coping with the normal work and stress of labor. All babies are monitored during labor. Most of the time, we leave these monitors on your belly all the time. Sometimes we can listen on and off with the handheld Doppler that your provider uses during your prenatal appointments. We have a set of monitors that can go in water, and we have a set of wireless monitors that you can use to walk around in your room or in the hallway. Your nurse is skilled at helping women move and change position, even when connected to the fetal monitoring machine. Labor and delivery is where you'll meet your baby. Although our doors are always locked, we are open to your visitors 24 hours a day. You may have up to 5 people in your room at a time. Your own children are welcome, but other children need to be over 14 years old. For the safety of all our families, we ask that no one with a cough, rash, or fever come onto the unit. Most women need support to cope with active labor, and labor and delivery is where we have options for pain management. When you are admitted, bring whatever you need to feel comfortable. LED candles, Christmas lights, aromatherapy diffusers, pillows, speakers, all are welcome. Just no open flames. You will need a car seat when you are discharged, but you don't have to have it on labor and delivery. You are welcome to bring any toiletries you want, but we also have the essentials if you end up leaving the house in a hurry. The mother-baby unit will supply diapers, but feel free to bring your own as desired. Pain is a normal and productive part of labor, but this is one of the only times in our lives when pain is expected. Usually, it is a signal that something is terribly wrong. It takes energy and practice to override all the fear signals that our brains send us when we are in pain in labor. It is absolutely possible to relax and to cope with the pain, but it's important to take some time now to think about what that pain means to you and how you feel about it. Ask yourself these questions and talk about them with your partner. Do you have any hopes for your labor? Any fears? What does labor pain mean to you? What pain management options feel right? We can help you have an unmedicated natural birth. We are also happy to be able to offer nitrous oxide, IV pain medication, or an epidural. Labor is a profoundly personal journey. There is no wrong way to have a baby, and there are as many right ways as there are women on this earth. What worked for you in one labor may not work in your next. Only you will know what is right for you in the moment. We are committed to keeping you safe and healthy, and part of that is knowing what you want for pain management. Tell your nurse. Are there any birthways, traditions, or beliefs that are important to you in your labor? We want to know so that we can honor your values and respect your wishes. We are skilled in supporting natural birth by promoting movement, walking, and position changes. We have birth balls, and of course, you're also welcome to bring your own. We are proud to offer a free birth companion program for qualifying moms. I encourage you to ask your provider for more details. Some women hire doulas for continuous labor support. We love working with doulas. Women birthing without pain medication are able to get into the tub and are encouraged to vocalize as desired. We are proud to have been among the first hospitals to offer nitrous oxide for pain management in labor. Nitrous is sometimes called laughing gas. It offers mild pain relief, helps you feel relaxed, and reduces anxiety. One of the great features of nitrous is that you control it, so you get the medication at the moment you need it most. You hold a mask to your face and breathe in the medicine. When you take the mask away, the effects pass very quickly. For this reason, it is available to women even during pushing. IV pain medication is another great pain management option. It is medicine for relaxation and mild pain relief that your nurse will give you through your IV. We use fentanyl, which is safe in labor because it is powerful enough to help you relax, but very short-acting. It is safe for women and babies to use in this controlled and time-limited situation. Women who choose IV pain medicine can have multiple doses in their labor. But we stop giving it before pushing begins because the medicine does cross the placenta to your baby. Moms feel sleepy and relaxed, and so do their babies. We want your baby to be born with a powerful urge to breathe, so we stop giving the medication around 9 centimeters so that there's time for the effects to wear off before your baby is born. The epidural is another powerful tool for pain management. Even if you don't plan on getting an epidural, it is useful to know what it is and how it works. Our goal is for you to be well-informed and prepared, even if the plan changes. An epidural is anesthesia that takes away the pain of contractions. It is medication delivered through a small tube that an anesthesia doctor, called an anesthesiologist, would place in your lower back. Medicine is then given by a pump through this tube until your baby is born. It is possible to get an epidural at almost any time during active labor. If your baby is about to be born, there may not be enough time to place the epidural safely before delivery. Nitrous oxide might be a good option in that case. With an epidural, you will be numb from waist to toes. You can't get out of bed, but you can still change position. You will also still feel tightening and pressure, just not intense pain. To place the epidural, an anesthesiologist will have you sit on the edge of the bed. The procedure is sterile to prevent infection, so only one person can stay with you. You will round your back like a shrimp, a mad cat, or the letter C. This opens the spaces between your vertebrae, the bones in your back. The doctor will cleanse your skin with a special soap solution. When it dries, they will numb your skin. This feels like a brief sting. After the numbing medication, you may still feel the pressure of the needle that the anesthesiologist will use to find the correct location to place the epidural tube. Once the tube is placed, the needle comes out. Nothing sharp stays in your back. Medicine is given through the tube that bathes your nerve endings and makes your belly and legs numb. The medicine is given until your baby is born, the placenta is delivered, and the doctor has completed any necessary repair. Most women regain full sensation and movement about 2 hours after the medication is turned off. When you are completely dilated, you will enter the second stage of labor. This is when you push. Right before complete dilation, most women experience another intensification of their labor. This is called transition, and is the time when your cervix dilates from about 8 to 10 centimeters. Some women feel surges of heat, uncontrollable shaking, nausea, or even a sense of discouragement. It is not unusual to hear women express that they just can't keep going. This is all a normal part of transition, and it's a positive sign of labor progress. Women with epidurals can still experience the physical sensations of transition. An urge to push is also typical at this time and is a good reason to get your cervix checked to see if you're completely dilated. Pushing is different in every labor. You're welcome to push in any position, and your nurse, doctor, or midwife can help and support you in determining what will work best for you. Women with epidurals can push in different positions. You just can't stand at the side of the bed because your legs are numb. Pushing for 4 minutes to 4 hours is totally normal. It can be a lot of work to figure out how to push effectively, which is why it is so important to rest in the early stages. At the very end of pushing, when your baby's head is being born, you may feel a strong burning or stretching sensation, even if you have an epidural. At this time, your nurse or provider will encourage you to take small pushes or to breathe your baby out as slowly and with as much control as possible. This can help prevent or minimize a tear. When your baby is born, he or she will be placed on your bare skin. Skin-to-skin contact for the first hour of your baby's life is our standard of care because it keeps your baby warm, helps relieve the stress of being born, which is hard work for both moms and babies. It also promotes bonding, stimulates the hormones in your body that help you produce milk. If mom is unable to have baby on her skin for some reason, a nurse may be able to help partners do skin-to-skin as well. It is also our standard of care to delay cord clamping. This means that we don't cut the umbilical cord right away. We usually wait 1 minute or until the cord stops pulsing. This supports your baby in the transition to breathing air. Anyone you want is welcome to cut the cord. If your baby is healthy, like the vast majority of babies, he or she will stay with you from the moment of birth. Occasionally, some babies need a little extra support to make their transition. In this case, our goal will be to start skin-to-skin contact as soon as you and your baby are safe and able. The third stage refers to the time in labor when you deliver the placenta. The placenta is the organ that connected you and your baby. It is an incredible filter that delivered all the nutrients and blood your baby needed to grow while keeping out toxins and removing waste. You are truly remarkable. Not only did you grow an entirely new human being, you also created a whole new organ from scratch. The placenta is usually delivered within half an hour of your baby's birth. It is our standard of care to give a medication called Pitocin to help you deliver the placenta and stop your bleeding. When your body is ready to release the placenta, you may feel mild cramping. You can see or keep the placenta if you wish, but we're also happy to dispose of it for you. Please let your nurse know if you have any special wishes or traditions regarding the placenta. Once the placenta is delivered, your nurse or provider will check to make sure that your uterus is closing firmly, as it should. It is normal to have bleeding. We will check frequently to make sure that your uterus is firm and that the amount of bleeding you're having is still normal. Once we know that your uterus is firm and your bleeding is well controlled, your provider will check for tears. Many tears will heal beautifully on their own and don't require repair. If a repair is necessary, we will make sure you have adequate anesthesia before placing any stitches. None of our doctors or midwives routinely cut an episiotomy. This may be done in an emergency and would be repaired very carefully. It is incredibly unusual at our institution. When women don't go into labor on their own, or if there is a medical reason to deliver your baby before labor starts naturally, the doctor or midwife may recommend an induction of labor. This means that we would use medications to start contractions and dilation. In this case, women are admitted directly to labor and delivery. There are different ways to be induced. Usually, your provider will start your early labor by using a medication called misoprostol, or a device called a Cook catheter. These are both good ways to soften and thin your cervix. When your cervix is soft, thin, and open to about 3 or 4 centimeters, we typically also use Pitocin to start the strong, regular contractions that will begin your active labor, dilate your cervix completely, and bring your baby. If you need an induction, it is important to be mentally prepared for a long process. That is because during an induction, all the work of early labor, which would usually happen at home, happens in the hospital. This can literally take days. It is important to have the realistic expectation that you will be in the hospital waiting for labor to begin for over 24 hours. Then, if it happens to be faster, you'll be pleasantly surprised. Come for your induction ready to sleep, rest, and relax, just like you would have at home. Some women will need a cesarean section. This is the surgical delivery of your baby. The doctors would make an incision in your lower abdomen and uterus to deliver your baby. Surgical birth happens in one of our 3 ORs on labor and delivery. You would receive anesthesia, and in most cases can have one support person with you. We are sometimes able to help mom do skin-to-skin even in the OR. When that isn't possible, our goal is to get your baby onto your skin as soon as you are stable in the post-anesthesia unit on labor and delivery. There is a great video that describes a mom's experience of a gentle C-section on the UNM Maternity Care website. If you are a mom who will be having a planned C-section, I encourage you to watch it and discuss gentle C-section with your provider. We are absolutely committed to keeping you and your baby safe, but we also want you to have an empowered birth. This means we want you to be at the center of every decision, that you and your partner feel fully informed at every step of your journey, and that we know and are able to honor your values, even if the plan changes. Please share your hopes and dreams with us. If we are misunderstanding your wishes or getting something wrong, we really want to know right away because we want to fix it. Please feel free to bring any question or concern to your nurse or doctor. Thank you so much for taking the time to view this video. We are truly honored to care for you and your family.